So in this video, what we're going to do is we're going to talk about issues, symptoms, concerns, discomfort, weakness of the stability of the shoulder blade. So it's more of a triangular piece. It sits about here. Some of the symptoms that come along with this will be discomfort, muscle spasms, trigger points. They will try to reach around, they will point to it. If you know if this area is bugging you. Now, in one of the other videos, we discussed this a little bit higher up problem, and I would recommend that if they're not really talking about here and they're more talking about here, I would go watch the other video, the trapezius trap T1 first rib video, because we did it on this shoulder, and it's just a different type of taping, and it is located in a similar area, but this is just going to be more exact for this particular problem. I've seen it where people would have an old injury here, and this is now a secondary issue, or they've had neurological problems down their arm, and they've now got what's called a winging. I'm going to show you what it kind of looks like when this shoulder blade wings like this. And if this is winging like this when your arm's in neutral, if her arm is laying in front of her and this is what they call winging like this, this particular type of taping will make this wing less and put less stress basically on the rest of the anatomy while the patient typically heals. So what we're also going to do, and what I kind of would like to get you to realize here, is if there's a problem here, there's likely a problem on the outside here. And so just to give you an idea of what I'm talking about is this area here. If there's a problem here, there's usually a problem here. So my recommendation would be twofold. Any kind of taping here, here, or here is going to help. Okay, so you can do full ones, full ones, full ones. You can do half pieces. So let's say I cut this in half, and now we've got this side. You can find where that shoulder blade is again. If you're not sure, have the patient or person do that, and then kind of look at maybe the freckles or the skin and just go, okay, that's where that side of the shoulder blade is. And I know you can't see it on film, but we all have some sort of freckle or something that can identify, so you can use it as a landmark. And then you can say, okay, well, that's the middle of the tape. I'm gonna go over that. And you could do like a 50% on the shoulder blade and a 50% off. And you could do a 1, 2, 3 with this. There's a lot of ways to help the shoulder blade just have more support, less pain, and help with any swelling or injuries when it comes to this. I have taped people where we're trying to stabilize and help the neck, shoulder by helping the shoulder blade, because there was just symptoms everywhere, where we would start way out here, just on the edge, coming around the arm, stretch it all the way across the spine, and then we would do one basically here and then all the way down. And you know, like I say in all the other videos, X marks the spot, and that typically goes really true specifically for this this particular problem. So even if you just had 2 pieces of tape, you could do one, and you didn't want to cut it, you wanted to use the whole piece, you could just do the edge here, and then you could take it across like so, and then you could do the second one like this. Or you could cut this in half. You could do, just to repeat myself again, you could do a couple of these at angles. So we could do this, we'll do a couple pieces. So what we'll do, we could also do down the edge and across. We could do this one. So what we could do today for the shoulder blade is we could do, remember, I know that the edge of the shoulder blade on the medial edge is here. So I could find the bottom, because if this is the top, there's the bottom. And if you're not sure, move your arm around. Yep, I can feel the bottom as she's moving it around. It's rolling right underneath my finger. So we could do, watch this, when it rolls, see how it's folded on itself? Just pop it like that. And if you really make a mess, throw it away and start over, because that is going to happen. So we could start low, pin it here, give it a tug, pin it here, and then let this fall off. And then let this fall off here. With a long one of the things that I like to do is get them to stretch it. So I will do further down to one end here. And I will go a little higher up. I will get the strap out of the way. And I'm gonna pin this side and just get that there. Then I'm gonna have her move her arm up and around. And we're gonna start there. I'm gonna do a good 50% tug. Leave a pretty good little piece of tail or whatever you wanna call that extra piece of tape there. Then I'm gonna have her move it across her chest. Really see how it's pulling and stretching? Keep going across your chest. Really, really use that arm, good. Then I'm gonna adhere it. And then she can relax. And what that does is make sure that this doesn't pop and this doesn't pop when she's maybe volleyball, throwing, tennis, anything. Because if you just tape it like this, the first big throw that they do, it's gonna pop here. That's gonna be a nightmare because they're gonna be in the middle of a match or something, and that's gonna be like coming off, and they're gonna wanna rip it off in the middle of whatever they're doing. So I want you to see that if you have another piece, if you only have a couple pieces and the problem is here, this is gonna be good. I don't highly recommend coming across and doing more, but I want you to see that I have this little piece and it's just not big enough. It's just not big enough. So I'm probably gonna have to go with another piece, and we can do that. We can, remember, this is the area of the majority of the symptoms. We've addressed this lateral side. We've done the lower edge because we have enough pieces, but we still have another piece, so might as well use it. So what we'll do is go, this is problematic. We'll kind of line up, see where we're going to land here. And then, so this is going to get a little interesting. I think what we'll do is we'll open this up here. We'll anchor it. Like that. Get it to stick. I'm not going to do too much tension, just a slight amount of tension. Where the skin is, I'm just going to get it to attach. I'm going to move this strap out of my way. I'm going to get it to attach. Pop the strap back over and we'll come back to that. We're going to move this strap out of the way. Anything that's in the way, not difficult to move. There was no pulling or tensioning on that lower piece. Then we've got this piece to finish with. Go ahead and just stay neutral. I'm not going to pull this piece, but I'm not going to go up in the neck at all. Mostly a couple reasons. One, the neck isn't really the issue at this moment, and there's wispy hairs, so I'm going to actually guide this one down and around. Let's see if I can get, I'm going to guide this one down towards the front like so. I'm going to give it a little turn and not just anchor it, just get it to line up just a little bit different, more off the neck. Because I had the extra space to do it and I didn't want to go up into the neck, I wanted to go down and around. So that would be wonderful for shoulder blade that was either unstable or had some trigger points in it.